morning, and thanks for joining us here at WDEF News 12 this morning. There is a new weight loss center available, and here with the details is Dr. Jessica Scotchy. Thanks for joining us today.
Thank you for having me.
The name of the center is?
Tennessee Center for Medical Weight Loss.
And this is not a surgery center.
This is not a surgery center, no. We specialize in physician-supervised medical weight loss programs, which are really unique in that we can individualize treatment plans based on patients' history, their medical problems, the medications that they're on, and what their ultimate fitness goals are.
And one of the nice things is you're doing this for all ages, and male and female.
Male and female, yes. We open this in conjunction with our primary practice, which is Tennessee Reproductive Medicine. So a lot of people think this is only for females, but actually we're seeing anyone in the Chattanooga, Cleveland area, male, female. Some patients have inquired about adolescents. We're happy to do nutrition counseling with adolescents. Don't use as much medication therapy with them.
And one of the nice things is you guys do a full medical history, and
yes,
also you find out, you know, what these people's lifestyles are like, what's causing
absolutely
this weight issue.
Right, and also all their we do a very thorough history of their medications, because there's a lot of things that can occur while people are losing weight. They might need lower doses of diabetic medications, hypertensive medications, or they can feel side effects from those things. So we can kind of help make sure that those things get the attention that they need while they're losing weight.
Exercise is included in the program?
We counsel them about wherever they're starting from, where do we get them to the ultimate, fitness level that they need to be at for their age and body type. But yeah, we absolutely do a lot of behavioral modification counseling and exercise counseling as well.
What about the food?
Yeah, so the food varies depending on how much the patient wants help losing weight. The most effective medical literature has shown over and over again that for people that want to lose a lot of weight, to start, meal replacement is extremely effective because you take away the choices that patients have to make every day.
And when we say meal replacement, we're talking about what specifically?
We do nutritionally designed shakes and bars that are specifically designed, FDA approved for weight loss, so that you can't just buy them in a store. They're nutritionally complete, so by eating these you would not get into any nutritional deficiencies that you could if you were just doing like protein shakes on your own.
Do you eventually move into food?
Yes, absolutely, because that's not what we want people to be on forever,
right,
and that's not for everybody. Some people will just do a customized, individualized, just regular food diet, maybe with an appetite suppressant to kind of just help learn how to eat healthy. But for patients that have, 50, 100, more than that pounds to lose, they often will start with that transition to kind of a hybrid, a modified program, and then go on to regular food, because absolutely we want people to be eating regular food and eating a healthy lifestyle.
If we hit our goal weight, then what?
So then we want to see you just for a little bit longer to make sure that you're continuing to maintain the weight. Some patients will continue to check in, periodically for 3 to 6 months, and some even periodically every 6 months after that, just to be accountable that the weight is not creeping up. And if we see it creep up, we encourage them to get back in immediately just to go ahead and get it off, those 5 pounds, for example.
And of course, the price is going to vary on what you need to do.
That's exactly
and
right.
Your weight loss issues.
That's exactly right. The initial consultation is only $19 for the full assessment, your body composition analysis that shows you your...
that's very economical.
Yeah, it's very affordable. And then from there, we show you the different options and what works within your budget and what your ultimate goals are.
And I assume there's some counseling too to help with the reason that people overeat.
That's absolutely right, because this is a chronic problem. This isn't for some people an addiction with food. We need to treat it just like we treat other people that struggle with those kind of problems. But unlearning things like emotional eating. How do you make good choices at restaurants? How do you shop at the store? How do you eat when you're traveling? I mean, all those kind of things.
Boredom is not a food.
That's exactly right.
It's not
with
a meal
women,
time.
We often are guilty of kind of reaching for the wrong things when we're bored. So anyway, yeah, so we work on all of those things.
All right, let's put the information on the screen for you now. If you're interested in this weight loss center, it's Tennessee Center for Medical Weight Loss. It's the only one in the Chattanooga, Cleveland area. You can call Dr. Scotchy and you can get in touch with her at centerformedicalweightloss.com, or you have another website.
Yeah, either mdbthin.com or you can do centerformedicalweightloss.com.
And you guys are located?
We are located right off of Highway 153 on Shallowford Road in the same building that Tennessee Reproductive Medicine is in.
All right, thanks for joining us
today.
Thank you,
Rachel.
Appreciate it. Stay with us. We're going to take a short break and be back. You're watching WDEF News 12 this morning.